Ladies and gentlemen, thank you for joining the Lake Superior Quality Innovation Network, participating in Physicians Quality Reporting Systems program. Your host, Jessica Postema, will begin.
Good afternoon and welcome to today's webinar. I would like to introduce you to today's content experts. First, we have Laura Sawyer, Clinical Application Coordinator at MPRO in Michigan. Laura is actively involved in MPRO's Physician Quality Reporting System program and has assisted providers in the development of practice-specific plans to adopt an electronic health record system and achieve meaningful use. Her experiences in the healthcare field have resulted in her development as a subject matter expert in the area of quality information reporting. Also joining us today is Candy Hansen. Candy is a program manager at Stratis in Minnesota and has more than 20 years of experience working in long-term post-acute care settings in public health. Candy was a project manager for the Centers for Medicare Medicaid Services special innovation project called Health Information Technology for Post-Acute Care. She is a graduate of the Leadership in Health Information Technology for Health Progressions program from the University of Minnesota and the Practice Facilitation Certificate program from the University of Buffalo. Our final content expert is Marnie Anderson. Marnie is a health IT specialist at MetaStar in Wisconsin and has forged solid working relationships with healthcare practices throughout Wisconsin, facilitating their understanding of government programs, including meaningful use in the Physician Quality Reporting System. Marnie facilitates reporting of preventive healthcare measures through learning sessions, best practice sharing, and technical assistance to provider organizations. Marnie has also facilitated more than 100 HIPAA security risk assessments. At this time, I would like to turn it over to Laura.
Thank you, Jessica. In today's call, we're going to give a brief introduction to the LSQIN, the objectives of our initiative, the Physician Quality Reporting System, known as PQRS, and then also the Value-Based Modifier program. We'll give a brief refresher into PQRS and then also the Value-Based Modifier, the benefits of participating in the initiative for the provider, what our expectations of the provider are when they participate in the initiative with the LSQIN. We'll also give directions on how to sign up to work with us, and there'll be an opportunity to ask questions at the end of today's presentation. The Lake Superior Quality Innovation Network, known as the LSQIN, is made up of 3 quality improvement organizations. These include Stratis in Minnesota, MPRO in Michigan, and also MetaStar in Wisconsin. Together, we support the Centers of Medicare Medicaid Services priorities for healthcare quality improvement. We will be working together to improve healthcare for Medicare beneficiaries, share best practices, and maximize efficiencies. The quality improvement initiatives that the LSQIN is working on together include improving cardiac health and reducing cardiac health care disparities, reducing disparities in diabetes care, improving prevention coordination through health information technology, which includes assistance with meaningful use, reducing healthcare associated infections in hospitals, reducing healthcare acquired conditions in nursing homes, improving the coordination of care between healthcare settings, and finally, the initiative that we're talking about today, improving quality through performance-based incentives and reporting systems by reporting PQRS and participating in the Value-Based Modifier. The scope of work began on August 1st, 2014 and will go through July 31st, 2019. Together, we'll be working on all these initiatives with an emphasis on aligning the tasks. This will allow participants to meet multiple quality improvement goals without duplicating work efforts. In today's call, we will discuss specifically the Physician Quality Reporting System and Value-Based Modifier initiative. The objective of this initiative is to improve quality and efficiency of care given to patients. Also, as PQRS moves from a pay-for-reporting program to a pay-for-performance program by introduction of the Value-Based Modifier, the LSQIN will assist eligible professionals to improve measure performance. Will also improve health for populations and communities through the use of HIT. As a reminder, if you want to report PQRS for the 2014 reporting year, February 28, 2015 is the last day to submit your 2014 PQRS data if you're choosing to report using your EHR. If you chose to report via claim, you should have been reporting your 2014 PQRS data as you submitted your claim. And if you're choosing to report through a registry, you will want to talk to your vendor about what deadline they need you to submit your PQRS data so they can get it to CMS on time. To successfully report PQRS for 2014, you must report 9 measures across 3 national quality domains for 50% of your Medicare population. If you successfully report, you are eligible for a 0.5% incentive of your Medicare Part B charges. If you do not successfully report PQRS, then you will be subject to a negative 2% payment adjustment on your Medicare receivables. This is the last year that you can earn a PQRS incentive. You can also choose to report PQRS in 2014 to avoid the penalty but not earn an incentive. And to do this, you must report 3 PQRS measures across 1 domain for 50% of your Medicare patients. As I mentioned earlier, PQRS is moving from a pay-for-reporting program to a pay-for-performance program, and this is being introduced by the phase-in of the value-based modifier. What the value-based modifier does is that it assesses PQRS measures for both quality of care and the cost of that care under the Medicare physician fee schedule. Depending on the cost-to-quality ratio, eligible professionals may receive an additional incentive or penalty, or they may remain neutral. In the terminology for the value-based modifier, that incentive or penalty is referred to as an upward or downward movement. The phase-in of the value-based modifier begins this year in 2015 based off of your 2013 PQRS data, and the phase-in will be complete in 2017 based off 2015 PQRS data. And finally, the phase-in is determined by your group size. So groups of 100 or more will see that upward or downward movement in the year 2015 based on what they reported in 2013. Groups of 10 to 99 will begin seeing that upward downward movement or that value-based modifier in 2016, depending on what they report for their 2014 PQRS data. And finally, the phase-in will be complete in 2017 when all physicians or physician groups will see the value-based modifier upward or downward movement based on what they report for 2015. So although the PQRS incentive is going away this year in 2014, you are still eligible for an upward movement through the value-based modifier. On this slide, we have a little bit of an example of how you get that upward or downward movement based on your quality of measures that you report to the cost of measures. For performance year 2014, the value-based modifier will apply in 2016, and it affects the group sizes a little bit differently. So for groups of 10 to 99, they will not yet be eligible for the downward movement because 2016 is the first year that they're eligible for the value-based modifier. So this would almost be like their baseline data where they have to work from. But as you can see, if they perform high-quality care at a low cost, they could get a 2% upward movement or a 1% upward movement. Otherwise, they will remain neutral. But you really see the value-based modifier upward, downward movement into groups of 100 or more. And this is because this is the second year that they have participated in the value-based modifier. And so they will be eligible for a 1 to 2% upward movement or incentive, or a 1 to 2% downward movement or payment adjustment. When you look at this example, you can almost think of it as being graded on a curve, where at the top of the class are the high-performing eligible professionals, where they're giving high-quality care at a low cost, and at the bottom of the curve are the eligible professionals giving low-quality care at a high cost. But the majority of the eligible professionals will fall right in the middle, where they remain neutral or get a 1% upward or downward movement. You can utilize your quality and resource use reports, known as QRURs, to determine how your practice will fare for the value-based modifier. These reports are available to download on QualityNet, and right now they're available for groups of 10 or more. What the report shows you is your quality composite score, your cost composite score, and then where you fall compared to other physicians. So you can see on this example there is a red dot, and that would represent this individual's quality and resource use report, and the other dot represents the other eligible professional. On this page here, they do show whether or not the eligible professional would qualify for a high-risk bonus adjustment, and what that means is that the physicians treat high-risk beneficiaries, and then they also show what your value-based modifier payment would be. In this example, they did remain neutral, but it would show you if you fell into that upward or downward movement of 1 to 2%. If you do have additional questions about the value-based modifier, or you need assistance in reporting your PQRS this year, you can contact your state representative, and we do have that information available at the end of today's presentation. And we'll also have Q&A at the end of today's presentation if you have additional questions about how this will affect you. But at this time, I'm going to pass the presentation over to Marnie at MetaStar, and she will talk about participating in the initiative with the LSQIN.
Thanks, Laura. I think I have the ball passed. Are we all on the benefits of participation to the provider screen?
We sure are.
Fantastic. Well, I took a look at the attendees list, and I know that there are a lot of people that I know from the last 4 years or so working with meaningful use and PQRS, and I'm sure the same is true for Laura and Candy. So we're happy to see you all. If there are new faces and names, we're also happy to see you. As Laura mentioned at the beginning, we're now the LSQIN, so you may know us as MetaStar, or YTech, or MPRO, or REACH, or Stratis Health, but going forward for the next 5 years, we are your Lake Superior Quality Innovation Network, and there's a lot of work to be done, as you could tell from Laura's presentation on PQRS and the value-based modifier. This move from pay for reporting to pay for performance, there are a lot of moving parts, there are a lot of new initiatives, and we wanted to give you a feel for how we'll be here to support you for that. So on a real high level, we're all about quality improvement, and our goal is to help you, the provider office, utilize improvement strategies to improve your quality metrics. So, what are you seeing in your data, and where can you make some adjustments? The other idea is that we will network with you and similar facilities and practices so that you can support each other, learn from each other regarding best practices, for example. And as we also mentioned at the beginning, the PQRS is just one initiative that we'll be working on with CMS over the next 5 years. So our goal is to not operate in silos for all of these different initiatives, but to actually collaborate with cardiac, diabetes, and meaningful use initiatives in terms of sharing education and interventions. There we go. I had a little mouse issue. The other benefit to you, and if you worked with us in the past, you understand that you will receive technical assistance as a participant. So those technical assistance activities could take a number of different shapes and forms. One may be assistance with the IACS registration. That's going to be a very important gateway into the portal to see your QRUR reports, for example. We will also be able to help you navigate through all the different measures which you should select for your practice and specialty, different improvement strategies, as we mentioned before. And in terms of trying to align the PQRS measures with your EHR incentive program work, meaningful use, we may be able to help you in terms of deciding which clinical decision support alerts need to be on in your EHR. We'll also be able to provide education on the actual submission of your PQRS measures. And again, the idea going forward, starting in 2014, was that if you're doing meaningful use and PQRS, there is this option to report once. So we want to make sure that we can find some efficiencies there for you as well. The quality and resource use report that Laura covered, that's something that we will be able to review with you once you've downloaded it and provide feedback regarding those cost and quality composite scores, help you understand what all of these different measurements mean and how that's going to affect the value modifier adjustment. In addition to the technical assistance that you'll receive, we'll also be creating learning in action networks. So something along the lines of the webinar we're doing today, where we can really create what we call an all teach and all learn environment. The other thing to know about this kind of a learning in action network is that it's an entirely at-will network. So you can choose when to participate. There'll be webinars and other activities almost monthly for the next 5 years, and some may be appropriate to your organization, some may not. It's really up to you. And our goal with that is to make sure that we're finding programming and network opportunities that you find valuable and that you'll want to share your best practices with us and with the rest of the providers and practices participating. So some of the things that we'll continue to educate on are, again, overall quality improvement, the value-based modifier. We may deep dive into that a little deeper, especially as the years progress, and that becomes much more of a focus in terms of where you are practice-wise. We'll continue to educate on PQRS. Those every year there's a little bit new to learn. The quality resource and use report, again, that's something that we will continue to provide education on the more it becomes available to everyone. And again, we know that you have many different initiatives. We have different initiatives that we're supporting, and our goal is to continue to really work collaboratively across those different initiatives. So, for example, we're talking about PQRS right now, but it really impacts our other initiatives such as improving cardiac health and reducing cardiac health disparities. A lot of the data that we will look at in that initiative come directly from PQRS measures. The same thing with diabetes care and really focusing on getting your patients the education that they need. And of course, as a participating provider, we do have some expectations of you. Again, if you've worked with us in the past, you understand these. We're a quality improvement organization, so we would expect that you'll be creating some quality improvement goals that we'll be able to support. In order to help you as you move forward in PQRS and value-based modifier programs, we'll also need to see your progress on a more than annual basis. So if you worked with us in the past, you'll be familiar with quarterly submissions of your PQRS measures. And this helps us help you stay on top of where you're doing well, where there might be some interventions. We'll also be able to provide you some feedback reports with some regional benchmarking, and we'll review those with you and, again, work on some improvements. And, again, the QRUR is an annual report. that will be provided to LSQIN so that we can continue as a group to help you understand those. We mentioned the learning events. We expect you to participate. There's no minimum threshold, of course. It's whatever is useful for you. And the individual technical assistance, that's definitely something we would hope that you'll participate in. And as we mentioned at the onset, we started in August, but we're going through the end of July in 2019. So our goal is that you come on board now, but you stay with us over the long haul. And as we can see, there's a lot going on, and there's a lot of collaboration to be had. And that's pretty much the end of my section. We do want you to know that these slides will be posted at the link here. There's a YouTube channel just for LSQIN. We do have some upcoming webinars. March, we'll be talking about PQRS in more detail and the Meaningful Use 2015 Final Rule. We're also available on Facebook and Twitter if you'd like to follow us. You can find us in either of those places. And if you are interested in signing up or hearing more about the work that we're doing, you can contact your state representative. So in Michigan, that would be Christy. In Minnesota, it would be Candy. And in Wisconsin, it would be myself, Marnie. And now I think we're ready to open it up to any questions anyone has about the LSQIN or even about PQRS and the value-based modifier.
Ladies and gentlemen, if you have any questions at all, please press the number 1 key. Again, if you have any questions at all, please press the number 1 key. And our first question is going to come from Catherine Hedrick from United Hospital Systems. Please go ahead.
My question is regarding the value-based modifier that's going to be in place for 2015 PQRS reporting. When they talk about the value-based modifier being applied, is that an application based on the percentage of performance met that is submitted versus performance not met? Is that how they're applying that?
This is Laura from Michigan. So what they're going to do, they're going to look at what you actually submit for PQRS, the individual measures.
Okay.
And they're going to look at the quality or like the performance almost, and then the cost of those measures, and then determine like where you fall on the ranking to get that upward, downward movement. It's almost like an automatic, so once you report your PQRS measures, they just automatically get analyzed. If you don't report PQRS, then it's an automatic downward movement of 2%.
So for instance, a higher percentage of performance met would create a higher value than performance not met?
Correct.
Okay. But is there anywhere where you can find specific percentages of what they're looking for performance met for each measure?
It's a comparative, so they're going to compare you to other eligible professionals.
Okay.
You really want to utilize that UR report to see where you fall, and then that you can utilize that and then improve on your measures to push for that upward movement.
Okay, so after we have our first year of data in there, that the value-based modifier has been applied to our facility or our individual EP.
Correct.
Okay. Thank you.
You're welcome.
Again, ladies and gentlemen, if you have any questions, please press the number 1 key. Again, if you have any questions, please press the number 1 key. Our next question is going to come from Tammy Stanger from Chippewa Village Orthotics. Please go ahead. Orthodontics or something. Please go ahead.
Hi, this is Tammy. I just have a question regarding PQRS. We have a clinic of 12 providers, and we have begun doing the PQRS measures as of 2014 via individual claims-based. And we are only doing the measures to avoid penalty. And is it my understanding some of those measures that we were reporting on have now discontinued? Some of the codes have discontinued with Medicare. So I just want to be reassured that we can continue to do the three measures. I was thinking it was under three different domains, but it sounds like it could be even be one domain, that we can continue that for this year.
This is Laura again from Michigan. So if you're reporting your 2014 PQRS measures via claim, you did only have to report the three measures and it only had to cover one domain for 2014.
Okay.
The measures do change year to year. So there is an updated guide for 2015 measures.
Yeah, I did review those.
Okay, so I would review those, and if there are changes for the 2015 reporting year, you would want to submit the updated code. Right.
So and that one just completely went away, that measure?
Okay, and that does happen. Sometimes they do retire, so you may want to pick another one.
Sure, and so it's still under one domain, but you certainly could pick them under three domains.
Correct, as long as you have the one measure, just to avoid the penalty.
The one measure or the three?
Three measures, the one domain.
Okay. Okay. That sounds good.
Okay.
We have another question from Catherine Hedrick from United Health Hospital Systems again.
Hi, yes, I'm calling. My other question is about group reporting. Currently, our facility, we report individually as EPs via claims, and we're looking at the availability of reporting as a group for our institution, which would be, I think, maybe around 78 providers. I guess we just have some questions. We have some questions about whether it makes sense for us to change to group reporting, if that could help us. And we're wondering, do we report as one group under our single TIN so that all of our EPs fall within this, regardless of specialty? And it appears that if we would change to group reporting, that we would have to do more than 9 measures then, that there'd be more measures that we have to submit. And then I have one more question after you answer that one, related to the same thing.
Okay. This is Laura. So if you want to report as a group, you do have to register to do so. Once you register to report as a group, it would cover all of your eligible professionals that report to that one tax ID. The only thing is, I don't believe you can actually report via claims when you choose to report as a group. I think the only option is to report as a registry through your EHR, or you could do the GPRO group registry, which I think you're referring to in the part of your last question. So if you did the GPRO web interface, then you don't have the option of what measures to report. CMS would tell you which patients to report on and what measures to report for those patients.
Okay.
But if you register to report as a group, and then you choose either the registry or the EHR option, then the criteria would remain that you choose your 9 measures to report as a group for all of 72 of your physicians.
Okay. I know that we saw on the CMS website that you had until June 30th to make a determination for 2015 reporting via individual or group. However, if we have already submitted some claims as individual EPs for our facility from 2015, can we still change?
Yep, absolutely. So you can actually, and I did check this out in the past, so I'm pretty sure that it would be the same moving forward, but I know in the past you could report multiple ways, and then CMS would take the way that you're more successful in. But the only thing is, once you register as a group, you do have to actually report as a group, where if you're reporting via claims right now and then later register as a group, they'll take that group registration and the option you chose there. But if you registered as a group and then reported individually, I don't believe that, I think because you registered to report as a group, but you didn't actually report as a group, then you would be penalized. But I could look into that more, and if you wanted to contact me, I could get some more clarification.
Yeah, I would really appreciate that. That'd be great. Okay. Is there a place where we can get a list of the web interface measures?
They are available online, but I could send that to you as well. But they are online at CMS's website. If you go to GPRO web interface, I believe there's like 22 different measures that are included in that interface. But my email address is the letter L, Sawyer, SAWYER, at MPRO.org, and that's M as in Mike, PRO.org.
And is it Nancy?
M as in Mike.
PRO at?
I'm sorry, what? It's L Sawyer at MPRO, M as in Mike, PRO.org.
.org. Okay, got it. And then we would still the value-based modifier would be applied to us under group as well for 2015 reporting.
Correct.
Correct. Okay. Thank you.
Our next question is going to come from Dennis White from Allegan General Hospital. Please go ahead.
Yeah, my question is in follow-up to the two callers before, where she was trying to clarify the number of metrics that had to be reported to avoid a penalty. And you stated in 2014 we could do 3 measures across one domain and avoid a penalty. Does that hold true in 2015? I thought 2015 we had to go to 9 measures across 3 domains.
I can double check on that. I know the 2015 final rule was released a little while ago. Let me double check on that. Unless, Marty, do you have a definite answer?
I would want to double check with the final rule also.
Okay.
Rather than just kind of spout. I think it remains the same.
Okay.
I want to check.
Okay, thank you.
And we do have on March 10th the 2015 final rule coming up, so there will be more details about 2015 coming. But again, if you do want to contact us, we can follow up with that question.
Okay, thank you.
There are no more questions in queue at this time. Our next question is going to come from Laurie Pong from Presbyterian Presbyterian Homes. Please go ahead.
Hi, can you tell me how I would find out what the cost of working with you guys is? Is there a cost involved, I'm assuming?
This is Marnie. There's no cost involved.
Oh, okay. Okay.
Oh. Mm-hmm.
And we can submit data through you to CMS?
No, we're not a registry or anything like that.
Oh, okay.
Yeah.
You would just help us with the submission.
Right. We would be, from a technical point of view, helping, find if you're going to use a registry, which registry is best for you. If you're using your EHR, getting all of that data out, understanding how to do the submission process through QualityNet.
That's awesome. Okay, and if we're interested in that, we just contact our local person.
Exactly.
Okay, thank you so much.
There are no more questions in queue at this time.
Okay, this is Laura again from Michigan, and I just thank you for joining us. And if you do have further questions, feel free to reach out to your designated state representative. I don't know, Marnie, do you want to move back a slide, and if anybody wants to jot down our information, they can do that.
Oh, yeah. Let's go back. I forgot I was in control. Here we go. That makes it easier.
Okay.
Well, thank you, sir. Since you've been on this call, you'll probably be getting some some updated information from us in the future until you tell us not to.
All right, I think that concludes today's call. Thank you for joining us.
Ladies and gentlemen, thank you for joining this complete show webinar. You may all disconnect and have a wonderful day.